It is really a pleasure to return to Doha and to meet all old friends that we have here, and my research colleague and I, Georgette Stratis, find it to be a wonderful country to visit, full of innovation and asking very difficult questions like this one. Now, the question of do doctors know best, I thought was an interesting one. I said to my wife, they've asked me to address the question and they want you to come talk about it. Because my wife is a nurse, a mother, and also somebody who lives with a physician. So the question of, do doctors know best? I thought, well, she might have an answer to that. And when my daughters call me and I say, hello, sweetheart, how are you? And they say, fine, we have a question for mom. They also know that the who knows best varies dramatically with what the question is. And so I think our challenge as we look forward here is to ask ourselves, first I want to just disclose that I do help Wolters Kluwer's Health look at web-based resources. But the question for me as a physician is less whether doctors know best, as whether it is how can doctors contribute their best in providing care for the world. So it's not so much that we should know best, but we have some best to offer, as does every other profession. And so to think about this with you, because I hope that every one of you will leave this today with a different sense of those of you as physicians as to where you might contribute more, and those of you as non-physicians as to how you can help the physicians contribute what they can contribute and collaborate with you. To think about this, I thought first we could talk a little bit about the evolution of medical education, how it has changed. And I'm going to go over quickly a historical evolution, while how the competencies have evolved that you have heard discussed today, and also some schemes for considering medical care and how they might help us evolve. Well, the historical evolution of medical education has been one that has moved with and through science. Science has been the essence of medical education. Our question has been, how do we train physicians to know as much as possible about the science of the illnesses that they face, of the science of diseases? And that has remained as still a very powerful issue, because as one approaches a physician, there needs to be knowledge of a science. And there's also been an evolution on patient-physician communication. I've had a great interest in this recently in looking at how physicians have been trained to talk with patients. And this has evolved from a very paternalistic model. Some of the writings in the last century and in the century before, the 18 and 1900s, gave very strict advice about how physicians should give instructions to patients about what they should do. And as patient autonomy and the changes in the belief system of the individual in the world have changed, and the access to knowledge, the recognition that physicians and patients are in a collaborative role has become more evident. So that physicians need to take on a new set of skills of collaboration. And now an evolution of professionalism. What does it mean to be a professional? Well, we've spoken already today about milestones. Well, milestones are commonly about science. Some of the milestones are about science. Some of the milestones are about individual patient care. But the medical profession itself woke up about 20 years ago to recognize that we had not focused on healthcare delivery for populations, that we had not focused on quality improvement, that we had focused on what you need to know at the time of graduation, not what you need to know 20 years after graduation. So we've evolved, and the competencies have evolved to add, as the ACGME and CanMed have done, an emphasis on practice-based improvement and system-based care, in addition to the other more traditional questions of medical knowledge, of patient care. But the issue of professionalism, and I would have you look at these 6 items and have each of you try to draw a new picture of what those 6 competencies are. Well, many people would put 5 of them under the concept of professionalism. That as a professional, we must keep up with knowledge. We must keep up with patient care. We must keep up with learning about new ways of interpersonal skill and communication. Because the interpersonal skill and communication that you and I use as a physician may differ dramatically with the culture of the patient that we're speaking to. As I think about the opportunities that I have at Stanford in an afternoon and a general medicine clinic, in which there may be 6 or 7 different ethnic cultures in that clinic, the decision as to what to do with each culture varies dramatically. So it becomes a real challenge, but fortunately we're evolving. So what I'm going to end with is giving you a scheme, a couple of schemes to think about where physicians might play a bigger role and how we might help them to play their appropriate role in medical education. This first scheme I'm going to highlight for you is a scheme we developed for looking at what teaching is. And this particular scheme says that every teaching interaction has a triangle, in which at the top of the triangle you see there's a relationship between the teacher and the learner. And on the sides of the triangle is how the teachers and the learners interact with the material to be taught. But I'm going to take you from that particular triangle to one that was developed by one of our colleagues who joined us, that says that that same triangle exists in patient care. That in patient care there is a relationship between the physician and the patient. There's a relationship between what the physician knows about the disease and what the patient knows about the disease. And also on the outside of that particular diagram, to notice that there's an incredibly important relationship between the patient and their environment, the physician and their environment, and the environment's influence on disease, which brings in this whole area of public health. Now, as we look at that particular diagram, we might ask ourselves, where in our medical education do we touch on these arrows? For many aspects of medical education, we're touching on the areas of what we know about disease, and less on the other areas, which become critical in healthcare delivery. And that particular diagram becomes more complex when one recognizes that it's not the physician alone who's delivering care, but it's the physician who is connected with a team. It's the patient, not only the patient, but their family and their environment. And it's not only disease, as we've spoken about, but it's disease and wellness. So as you and I look at this particular diagram, we may see a variety of places where physicians need to be given new skills and where physicians can bring themselves to the skills needed to the deliberation of the healthcare environment, of healthcare as well as medical education. On every aspect there, how do we work as team members? How do we connect with the patients and their families? How do we pay attention to public health and its influence on disease and wellness? So my suggestion is that physicians neither know best about any one of these things, but they have a critical role to play. That each of us who are in medical education should try to inspire those who are entering as physicians to join up with others who are focusing on these areas of medical education and healthcare delivery. So my call to this is, how can doctors contribute their best in providing care for the world? It's with a single word: collaborative care. So that you and I, in enhancing our roles as physicians, will expand collaborative care with patients, who are clearly our partners in the care that we provide, with the healthcare delivery systems, where physicians have been very, very much in the background, have not necessarily taken responsibility for the quality of the system in which they work. But now, fortunately, through a lot of the efforts by many people in this room, the idea that each of us as physicians has a responsibility to the medical delivery system in which we reside. And then finally, with society. There is no need to reemphasize that physicians have a contract with society, but it's not a contract that's with them alone. It's with them and every other healthcare provider with whom they can collaborate. So my daughters will tell you, doctors don't always know best, but once in a while they could be consulted. Okay, and I'll end with that. Thank you very much.